a Da Vinci robot minimally invasive hysterectomy is one of many types of minimally invasive surgeries that we perform here at Baptist today. The robot is just one method of many in order to perform a minimally invasive surgery where you have smaller incisions, quicker recovery time, back to work, that type thing. And the thing that robotic surgery brings to the table is the laparoscopic instruments have more articulation than straight laparoscopic instruments do. They move like your hand moves. And also it has the ability to zoom in. And so getting around angles or things that technically might be very difficult with straight stick laparoscopy, with a robotic surgery, you're actually sitting comfortably at a console, and by utilizing your hands, you can articulate and manage very complex surgical conditions. And the patients, most of the time, would go home the next day, and so that's very satisfying to see those patients do so well, get back to their normal activities so rapidly. I think my mission as a physician is to come to work every day and to try to comfort my patients, to deliver them what they need, whether it be comforting words of advice or whether it be clinical decision making in order to alleviate their pain or suffering, to just try to do the best job that we can to take care of the patient and remember that the patient's always the priority. Of course, I've been doing obstetrics for a good while, and so it seems my practice now is perhaps more involved in high-risk obstetrics. But I really have a passion for that. I love that. I think in order to be a good obstetrician, you have to have a passion for it. High-risk pregnancies would include those women that have chronic medical conditions such as chronic hypertension or diabetes. Multiple pregnancies is something we see more of, twins and triplets occasionally. That, of course, is high risk. And maternal age is another high-risk condition that I definitely see more of than I have in the past. I think most of my patients know that I'm the father of 3 daughters, and that's been a real privilege. They know that. They may not know how much I enjoy my work. I mean, that's a real blessing to be able to thoroughly enjoy what you do when you go to work every day, and it's a real privilege to take care of our patients, and to me that is just the ultimate compliment.